our next session. Dr. Bhoja, come on up, please. We're going to introduce our next doctor. Now, Dr. Bhoja, now, did you travel all the way from someplace far away?
Yes, sir. I think it's, I don't know if it may be 5 miles or 6 miles from
5
this
or
place.
6 miles, right?
It's a long ride, by the way.
It's a long ride, yes, indeed. Where exactly is your office? Which area?
We are located on 1604 and Northwest Military, Shavana Park area.
Yes, indeed.
And then I live, close by here too. So, but still, yeah, it's a long way.
It's a long way. Oh, and we got to get my back on this too, because Dr. Hano was making fun of us. Yes, sir, we do have pickleball. Chicken and Pickle is right up the street.
We do have it right here, sir.
Yes, sir. Yes, sir. It's coming. It's
here.
here. It's not coming. It's here already. So, Dr. Bhoja, you were here last year. You're going to share some new things with us this year, and we are looking forward to that as well. So I know we started a little late, so I don't want to take your time. So I'm excited to hear what you have. So the floor is yours, sir.
Well, thank you, AJ. Yeah, thank you very much. I think we're going to actually, let's offer something different. I want to first thank the organizers and Dr. Prince right there. So they requested us to have something different this year. So it was a pleasure. It was a pleasure speaking last year, and we did, talk about the lifestyle medicine and what lifestyle medicine can actually offer, and then how it can help combat your chronic diseases. But this year we were requested to bring some proof. Are there any real cases? I love Dr. Harvey's talk actually, because I always love, enjoy listening to him. It's not just he's funny. He's a cardiologist. In other words, let me ask this question. What's the number one killer of this country and the rest of the world? Heart disease. This program is actually directed by Dr. Prince. He himself is a cardiologist. And always the prime speaker, we love Dr. Harvey himself is a cardiologist as well. In other words, I hope you get the message. The answer is not in the stents, not in the cath lab. Don't even get to my cath lab, right? Don't try to think about, getting the bypass and all that. So that's the message we should get, meaning there is a solution in your lifestyle itself. So having said that, we introduced what lifestyle medicine can offer in theory last year. And this year, we were honored to bring some of our success cases. And okay, so let's have a couple of slides right there. So having said that, we are bringing some of the evidence, some proof. Let's have the advancer. First of all, are you having fun so far? I know this is not a lecture mode. I think this is one of the reasons why actually they wanted me to kind of bring some of these real cases. Don't get bored. Feel free to ask questions. Hold those questions up, type it in so that we can answer either today or tomorrow. There you go. Think about yourself or your family. Is anyone in this room or in your family fighting any chronic diseases like obesity, diabetes, high blood pressure, high cholesterol, heart disease, cancer, liver failure, right? Fatty liver, any autoimmune disease? Anybody? Unfortunately, you're not alone. In other words, 6 out of 10 Americans have at least one chronic disease. And 4 out of 10, that is nearly half of us, have more than 2 or more chronic medical conditions today. And that's the sad state of the nation. After practicing for more than 15 years, seeing thousands and thousands of patients, I just came to a realization that every single person is getting sicker nowadays. They're on tons and tons of medications. And sure enough, I caught myself one day turning into one of those patients. And after losing 40 pounds and nearly flipping every lab value, my metrics, I decided to do something. Offer a plan, a program to our patients in our community where they can combat these chronic diseases through lifestyle change so that they can rely on less and less medications. And that's when we decided to kind of launch our clinic in Yumi Health. And sure enough, we are proud of our patients. They embrace the lifestyle change. They followed our protocols, all our instructions. And they did make a difference. and started quitting, not just losing weight, 20, 30, 40, 50 pounds, without these crazy Mounjaro, Ozempic, and Wegovy, not just flipping their high blood pressure and cholesterol and diabetes, across the board, they started enjoying a brand new life. And we call them our New Me champions. And it's an honor and pleasure to bring 3 of those. We're actually blessed to have 3 of our such champions agree to share their stories with you all to inspire today. And tonight, I'm bringing 2 of them, and we'll have the 3rd one tomorrow. So ladies and gentlemen, put your hands together for David. Please, David. And our second champion to share his journey and the story is our Nikhil. So what we're going to do is actually, I didn't realize that these chairs are actually stuck together. Okay. I think this is the social bonding, right? Yes, so we're done with the social distancing. Now it's bonding. So what we're going to do is actually, we're going to make it actually a little interactive session. So we love to hear their stories. Because one of the challenges is, we know in theory that changing your diet, adapting the lifestyle, the exercise, as Dr. Harvey was emphasizing, and stress management and so forth, we know that it can actually make an impact. But it's hard to find somebody around in your neighborhood, in your own family, that this thing works. And that's the very purpose of this session today. We have David. David actually, he's been a sustaining member of our program since the inception of the clinic, and then just through lifestyle. He was able to bring his triple-digit high blood pressure, meaning 200s and over 100 blood pressure down into normal range without a single high blood pressure medication. And Nikhil, after fighting for maybe 10, 15 years, I think he was able to improve his hemoglobin A1C, which is a diabetic marker, from double digits into single digits with less and less medication, not by doubling of the medications. So having said that, I'm going to start with David. David, if you can just paint a picture, take us back in time, and share how was your health or your life before discovering New Me Health.
Hello. Good evening.
Go for it.
Okay. Let me just tell you a little bit about myself. I guess I've been whole food plant-based since 2013. The genesis of me changing my lifestyle in 2013 was a significant emotional event. I was diagnosed with cancer. I also chose to retire that year, so I was looking forward to enjoying the fruits of my labor and those kinds of things in front of me. And all of a sudden, I had melanoma under my fingernail. And it's serious, but it's not a big deal. But what it allowed me to understand is that I had high blood pressure, because they were talking about postponing my surgery because my blood pressure was very high. And I'm thinking, oh boy, I have a lot of things going on here, but what can I do to get in front of this? And I started reading, I started getting research. A friend told me about Forks Over Knives, which is a documentary that talks about how nutrition and food can make a difference in your health vectors. And I embraced a whole food plant-based diet, and I saw some benefits. Over time, I continued to eat vegan, which is not necessarily always healthy, and my health had gotten to a point where I put on, additional weight. Initially, I had lost about 50 pounds, but I knew I needed to lose more. I knew my blood pressure was high, and so I was almost in a panic. I need to do something. And I was able to look on the internet, where all kinds of good and bad information is, but in this case it was very good, and I found Dr. Katipally and New Me Health Clinic. And it just so happened I called at the right time.
Yeah.
We talked. He suggested I come in for an evaluation. A lot of the information I had been exposed to through various conferences I had been to, books I had read. So I was a true believer in whole food plant-based living. What I lacked.
Yeah, actually, when we met, that was a little challenging to me, because we rarely started the program. And then here comes a learned man. He attended so many conferences. He pretty much, actually, he read more books than me. I mean, in the sense, he met the experts in the lifestyle space. I was like, David, I mean, you already kind of followed, a lot of people, and you lost about 40, 50 pounds already. And I don't think there's anything left for me to squeeze out. There's no juice left, right? But I think what caught my attention was his blood pressure was pretty high on that day.
Yeah.
So 200 is over 110, 120. And I just told him that if you found me in my regular clinic, in my university clinic, I would never let you go without a pill. Not just a pill, 2, 3 pills. But he's been, leading that, managing with that pressure, and he chose to work with us. That's when I think we started the program. Let's hear from Nikhil and see, Nikhil, take us back. And then I know you had a long journey. But I don't know, I think just take us back and see what kind of situation, diabetes you had, and then how were you managing before you found us?
Sure. Can everybody hear me? Good. So I have been a diabetic for about 16 or 18 years. And I thought metformin would do the job, right? So I started with 1 dose, couple of doses, and it kept on increasing over the last 16 years. And all diabetics somehow believed you take the pill, continue your normal life, right? It doesn't happen that way. It stops working after a while. Until late 2023, I had to be rushed to the ER with a very high blood pressure, right? And so after getting discharged, I was on like 5 tablets or 5 pills for sugar, blood pressure, cholesterol, and all the diseases that you were seeing here earlier. And then I had to do something about it. And that's where I started researching, is pill the only solution to diabetes, right? And all the other complications. And that's where I ran into this New Me Health as a program to be able to reverse. So I just thought I'll give it a shot and see, if not anything else, well, at least I'll become slimmer. So that's what I kind of signed for.
Absolutely, yeah. I think, I think every single patient that comes to our practice is, that's what excites me. That's what keeps me up all night, every night, because what else can I do? Because there are patients who are actually genuinely, where the defect is. Because this is always, it's a kind of detective work, right? And when you get a patient, I said to Dr. Ben, the nodding his head, I know, where how the gait of my patient and where I can fix his, gait and then through my therapy. But certain cases, I think some of the challenging, patients we had were obviously, genuinely they tried something, they know something. So I think it makes you exciting and then challenging as well. So having said that, I think you already kind of mentioned a little bit. Let's get back to see how you actually even found us, because you've been doing a lot of research, David. How did you find New Me Health as your potential source for the next stop?
Well, as I mentioned, I was looking for a whole food plant-based physician. And I did a search on the internet, and New Me Health popped up in San Antonio, and I was pleasantly surprised that there was, a physician here that saw the value of changing diet and lifestyle as an integral part to healing. And made an appointment, and we got together, and you explained the program, and I said, let's do it, So that's kind of how I got to New Me Health.
Sure. Anything particularly that triggered you, Nikhil, in finding us?
Oh yeah, the trip to the ER. But just beyond that, of course, I was really interested in understanding, can it actually be reversed? So I saw the ad on, I think it was Facebook, where it says, reverse your diabetes. I was like, oh, is this dream or what? So I just thought I'll give it a try, and here I am today.
Well, yeah, that was not just a big question on his mind, but the challenge on my side was Nikhil is actually is a pretty curious man. He doesn't commit to anything without an evidence or some kind of reassurance. So he actually walked in with lots of questions. Is it possible? Is there an evidence and so forth? So. And then I couldn't say that, I can make it happen for you, but of course, and I had to give the evidence that I had, and then what my, hope and expectations were. But having said that, so let's get back to the actual meat or the substance of the transformation. Let's start with you, Nikhil. What was your journey like? I mean, what kind of changes? Because in theory, we know there are certain things need to be changed, but what tools? What tools or maybe technology, what monitoring system, coaching, or any kind of, guidance, how did it help you make that leap, across the bridge to get to the other side?
Yeah. So I think it was a mix of just the monitoring tools. Obviously, you get to monitor your blood pressure, all the vitals on a regular basis. The second aspect was the exposure to it's not just the pills versus exercise versus diet, but really understanding all dimensions. I think one of the doctor also mentioned earlier. So stress, sleep, right, are equally important, as important rather, as much as exercise and your food habits. So understanding all this overall value chain of what needs to be done to really reverse it was a huge learning for me. It made me explore new recipes and things like that, new ways to exercise for the lazy person that I was, and all the things around stress and sleep as well. So it was a journey of about 6 months, and you may have seen the brochures, but it's like going from all the vitals you can think of, right? 2-digit A1C to a single-digit A1C, no pills for blood pressure, no pills for cholesterol, just about 20% for my glucose management, and that's it, right? So a big change. And the other thing is, I was a size 44 trouser or pant, and even 34 is loose for me. I'm just holding on to my, somehow with the belt.
Sorry, sorry Nikhil, for making your pants drop, right? But that's the change, because again, that's not just losing weight. As Dr. Hari was taking us back to those Ozempic and these weight loss GLP-1s, you're not just losing fat with those medications, you lose muscle mass. And the unfortunate thing is, when you stop it, when you bounce back, you gain more fat. So basically, from start to finish, if you look at it, you start from, let's say, 200 pound in a person, and you end up the same 200 pounder, but in between, you lost more muscle, you gain back your fat. That's where the insulin resistance, flips and everything. But it was pretty impressive. Yeah. So I think, as you mentioned, as you see up on the screen, 12 plus A1C coming down to 5.5, or which is a pre-diabetic or even non-diabetic, with a 90% drop in the medications, which is unthinkable. It's impossible to drop the medication and then drop my A1C numbers, because the trouble is not in the medication. Our body is not missing the drugs. There's something else is hurting us. I think that's what made it, kind of proved it, like many of our diabetic patients. So David, so how was your such a scary, because I don't know, what's scared you in your life? The melanoma, which is a cancer, or the high blood pressure?
Well, I lived a fairly high stress life. Work was intense. I traveled quite a bit. Had all kinds of things going on at different times. But yeah, you just can tell. People know when you don't feel well. So I knew I was in the zone of danger. And while I didn't take my blood pressure on a daily basis, I could tell something's not right. And the 220 over 120 was a bit of a shock. And but you made a huge difference. I think the things that really made a difference was holding me somewhat accountable for me. And you do that through a lot of the tools, a lot of the information that are there. And most people that are rational will say, okay, if I got this information and I notice certain things, then I'm going to do something about doing the positive things and some things about not doing the negative things. And I think your whole approach to medicine, to me, was very unique in that you were able to come up with a tool set and a process that one could adapt and begin to see change and kind of monitor it on your own. I mean, when you did something that you shouldn't have done based on your blood pressure in a day, or your diabetes, even the measurements there. You ate something that you probably shouldn't have, or you did something that triggered it. So it's very empowering for an individual to begin to own the responsibility for their health care and not necessarily outsource it to a physician. I mean, they're there to guide you, but you're there to kind of take care of yourself to a large degree, which is very important. Once you have information, you can't unlearn that information. And so I think that piece was
Yeah.
very attractive.
That's certainly exciting because it's not just the information that we need. And I think that we're proud of every single one of our patients because embracing that lifestyle is not easy. What we do is basically we create the environment because we need reassurance. We need certain wins. That's what we call micro wins. And every week, our patients are actually celebrating their kind of little things, and right, at a time, one step at a time. But we need the reassurance. One other thing is basically, I think our audience right here, I think our friends, they might be curious today because this session, this year's session, the theme is actually exercise. We know we need to do some exercise, but we don't know where to start. And then we don't need to become an ultra marathoner to get to the right state of health. But if you can just kind of shed some light, any realization, Nikhil, that what kind of change did you do? I don't know if you're a runner or anything before. What kind of things, was it a big leap or small steps, or what kind of changes did you bring in terms of physical exercise?
Sure. With a size 44, I don't think I was a runner to begin with, but I think I did follow the program, guidelines to say start walking, then running, and so on and so forth. And thanks, doctor, for presenting the idea of strength training. What I have found is that if I walk for 60 minutes versus lift weights for 10 minutes, the lifting weights for 10 minutes is far more effective than walking for 60 minutes, just in my case. And I'm sure there is some truth to that as well. So thank you for sharing that evidence with others as well.
Yeah.
So that's a big thing. Strength training brings down my sugar, especially after a meal, like by 40 points, right, within a matter of minutes. So there is definitely, or just climbing stairs after a meal is a huge gain, personally for me.
Right. That's very, very true. In other words, I think that's, we see that across the board. And that's why we emphasize more on strength training, because we always want to, because for somebody who actually never even walked or ran, it's daunting for them to kind of ask him to lift weights, because conceptually we always think exercise means what? Walking, jogging, running. I don't have time to run, right? But that's just the foundation. And the cardio is just a foundation. That's what we teach. And when you're running on the treadmill or the track, you're burning calories when you're running. The moment you stop, it's done. Versus if you go to the strength training, there are two things that happen, 2 or 3 things basically. You're not just burning the calories while doing the strength training. It doesn't need to be lifting weights. You can use the bands. You can use your own body weight. Pull-ups, push-ups, Pilates, and what else, right? So when you're doing the strength training, you're asking the muscles to go to work, number one. And the muscles have different types of receptors. I mean, the glucose channels. And if you get to the details of the diabetes, the glucose, the gates, they open only when the insulin goes and knocks the door to kind of open up the glucose coming up, sugar coming up, right? At a certain stage, when you're a couch potato, when you're not moving and doing any physical exercise, you need insulin to do the job. When you're extremely high, super athlete, you need insulin as well. But when you actually engage yourself in a moderate exercise, a magical doors open, they're independent of insulin gates. In other words, even though you had very high levels of insulin resistance to start with, regardless who you are, you can actually open those magic gates. That's number one. And then when you stop the strength training, you don't stop burning calories. As Dr. Harvey was nicely putting it, your BMR, your basic metabolic rate raises, so you actually become a continuous energy calorie burning machine. Or in other words, who doesn't want to burn the calories in sleep? This is the secret. You can actually engage, you start strength training and you can actually burn in sleep. I'm not sure how and what kind of changes you brought up, David.
Clearly being more active, walking vigorously every day. I try to do 5K a day. I've added resistance to that process, and that has added more to the burn. I feel stronger. I think my posture is better. You feel good. You have energy. I try to do it outside, so you get to see the green and fresh air. I like doing it early in the morning. It's very invigorating, So those kind of things, are little tricks that you kind of do to incentivize yourself to continue with it and to do more of it.
Just as a practical tip, or maybe I don't know if you can have any, but people might be curious. Let me put it this way, David and Nikhil. you don't get any extra hour in the day. You have the same 24 hours. What made you actually start doing this? I mean, start walking, or maybe strength training or anything. How can you, flip it?
Okay. For me, and I'd even suggest that to anybody that's contemplating doing something like this, you got to figure out what your why is. Why am I doing this? Am I doing it for me? Am I doing it for my family? Am I doing it for a better life? And it needs to be something fairly substantial, not just a whim. I want to fit into this dress or this suit for an occasion. I mean, you really got to dig deep, because that's what's going to drive you. In my case, it was my family. I'm a grandfather now. I have a grandson. I want to see him grow and go to high school and go to college and be the best him he can be. Well, if I'm sick or if I'm dead, that's not a possibility. So you got to do things to put yourself in a position to be where you want to be, and that was my drive.
Yeah, I think it is pretty similar motivation. Self-motivation, I think, is the answer. If you're not self-motivated, you can't get anywhere. I mean, that's the truth. Right? And of course, the New Me program, on a lighter note, it was like going back to high school or school again. What's your grade this week? Oh, A1C is not dropped. Go back to work. So
But that's a part of the tool, because one of the things we say is you manage what you measure. So that's the beauty. I think we bring all the metrics that you are supposed to be watching on your screen. And that's what actually drives, because, right? We always say, there's no coach, nobody's brainwashing you. You watch yourself and then listen to your body and see how it's responding. If you can actually kind of, shed some light on just kind of quickly, results-wise, I think, the people might be curious, okay, so I think they did something. What kind of results did we experience or enjoy in terms of your blood pressure or your energy or your kind of total vitality? What do you see the difference, David, so far?
Okay, so on my journey, I've lost over 70 pounds. 25 of that can be attributed to my time at New Me Health. My blood pressure routinely is 120/80 range. I have a routine that I go through to get my exercise, to get my resistance. I've been able to sustain that. My outlook on life clearly is as positive as it's ever been. I enjoy doing things. I have enthusiasm. I feel better. People say I look better. I don't know. That's stretching it a bit
Maybe
more.
you should ask your peers and your friends when you're hanging around with your...
And that's the other thing. I mean, I'll be 72 this year. And, as I look at my peer group and I talk to them, they're in a different space in terms of health. And, we can't control the lottery of the genes that we have in our system. They are what they are. But we can change our outcomes by taking ownership of those genes and making choices that support where we want to be rather than take away from where we want to be.
How do you think your friends are doing, your peers are doing? Are there any medications or any troubles?
Well, I have peers that are in very serious situations, but they see it as a bridge too far to cross. And I'm saying, it's like one step at a time. You just got to make change, but it's hard for people. I'm not saying it's easy, but it doesn't mean you give up either.
Excellent. So in terms of results, Nikhil, if you want to make any, share any thoughts, what kind of numbers you had, and then how many medications were you on, and how many you think you're trying to manage right now?
yeah, I think I did share. So the A1C has come from like closer to 12 to under 6. Blood pressure's back to 120/80, so no medication. Cholesterol in range, no medication. That's for as far as the medication side of things is concerned. But I think what has changed really in the past 1.5 years is self-confidence. And there's an element of self-respect, right? So when people talk to you, they talk to you with a lot of, oh, you achieved something different. Maybe you are worth talking to, right? So that's the conviction that you develop over a period of time. Beyond just the numbers, right? So I think that has been a really wonderful experience and journey to a point where you become more conscious about looking at your plate and figuring out, oh, fiber is missing now, right? So it becomes like your second nature as to how you need to balance what you're eating, how much you're sleeping, and so on and so forth. So that's the qualitative side, but I think that is far more enriching for me at least.
Absolutely, absolutely. The quality, end of the day, it's the quality of life. That's what matters. And the self-empowerment, I think that's one of the biggest things. When you suffer from, I mean, if you're diabetic, yeah, I'm pretty sure every time that the sugar spikes, it just demoralizes, right? It just, kind of, there's no bigger penalty than that. And then finally, I think if you have any message for folks, just to go real quick, in terms of, is it possible? Is it doable? And then how hard and how easy can it be?
It absolutely is possible. I mean, I think I've experienced that. I know many other people that I've met around the country that have embraced, lifestyle changes and are doing great in terms of their processes. So it can be done, but you gotta have that, why am I doing this? I mean, I can't overemphasize that enough. And if that why really is at the core of who you are and where you want to be, it will be real easy. If it's not, you'll find all kinds of excuses as why you're not going to do this. The food doesn't taste right, or I got this to do, I got that to do. But get to that why is my suggestion.
I think that the beauty is actually you're not just kind of learning what to avoid. You discover a whole new world of different foods that are actually out there, and also the physical exercise and the joy in that. Just a real quick, in the interest of time, Nikhil, what message would you like to give to folks who wants to make a change in their lifestyle?
I think there's just one statement really, right? You never know what you can become until you try it. I think that's how I would sum my own experience in one line.
Absolutely, absolutely. Okay, so before we leave, I just like to kind of share this thought. Does anyone not know this man on the screen? Greatest inventor and genius, right, we think? Well, Edison said, the doctor of the future will give little medicine. The doctor of the future will give little medicine and will interest the patients in the care of the human frame, diet, and in the cause and prevention of the disease. Essentially, what he was saying is, he is such an inventor. I think he comes up with the crazy ideas about, for every trouble you can think of in life. He could actually come up with a pill, or maybe he could invent a machine that, hey, I had a crazy machine that can make the medicine. Instead, such a genius, he said, the doctor of the future should actually rely less on the medication and essentially focus more on the lifestyle. And that simple message is actually lost in time. And then finally, I like to kind of leave with these thoughts that always remember, lifestyle is the best medicine. And one of the proverbs that I always remember and share with our patients is one of my favorite Ayurvedic proverbs is when diet is wrong, medicine is of no use. But when the diet is correct, medicine is of no need. In other words, if your diet is wrong or if your lifestyle is wrong, I don't think any pill will work. Versus if you fix your lifestyle, you probably don't need any medication. And it's hard to put it in practice. And then finally, choose health over everything. That's one of the premise, the purposes of these gathering, year after year, that choose health over everything else. And then finally, add life to your years, not just years to your life. In other words, focus on quality of life. No one knows how long we're going to be here, but if you just have that, health as your priority, and then to improve your quality of life, I think you can easily find the way to get there. Thank you much.
Thank you.
Thank you, David and Nikhil, for coming forward and then sharing your stories, man.